So our lecture today is chronic suppurative osteomyelitis. In the previous lecture, we discussed acute suppurative osteomyelitis, and now we are going to discuss chronic suppurative osteomyelitis. Actually, chronic suppurative osteomyelitis could be primary or secondary. Primary, when the condition does not proceed by acute stage, it is called primary chronic suppurative osteomyelitis. But when the condition, I mean chronic suppurative osteomyelitis, preceded by acute stage or acute phase, in this case, it is described as secondary chronic suppurative osteomyelitis. So if the acute stage does not treat it adequately or inadequate treatment of the acute osteomyelitis, in this case, it may lead to the progression of the condition to chronic suppurative osteomyelitis. The clinical features of chronic suppurative osteomyelitis are similar to that of acute type, but it is milder. Why it is milder? Because here we can see there is sinus tract or fistula formation. Through the sinus tract or fistula, the pulse could be released, and this is decreased the clinical manifestation. So the pain, there is pain actually in case of chronic suppurative osteomyelitis, but the pain usually mild to moderate. There is swelling, and the swelling is indurated, but the larger of the swelling, but the size of the swelling is less larger than that of the acute stage. Also, there is paresthesia or anesthesia of the lower limb, but the condition is less than that, or the manifestation is less than that of the case of acute. Also, there is lymphadenopathy, there is pyrexia, sequestrum formation, which is more obvious in case of the chronic stage suppurative osteomyelitis. Actually, when the acute stage, when there is 4 weeks past the acute stage or acute suppurative osteomyelitis, in this case, we can describe the condition, or the condition might be converted into chronic suppurative osteomyelitis. So in this case, sequestrum could be seen more obvious, and also there is sinus tract, and all these actually the manifestation or of the chronic suppurative osteomyelitis. In addition to other manifestation, which is mild to moderate pain, there is swelling also, there is lymphadenopathy, pyrexia, and so on. Acute exacerbation of a chronic stage may occur. Acute exacerbation, that means, as we mentioned before, the sign and symptom of a chronic suppurative osteomyelitis are less or mild than that of the acute stage. But sometimes the sign and symptom or the clinical manifestation might become more aggressive for certain reasons. For example, in case of blockage of the sinus tract or the fistula, this may lead to acute exacerbation of the chronic suppurative osteomyelitis, or the immunity of the patient decreased, so also this may lead to exacerbation of the chronic stage. Fistula tract may form, which open into the surface, as I mentioned before. Here we can see there is fistula, and this is fistula open within the surface or into the surface. This might help to release the pulse. The management, actually, also there is medical treatment, and also there is medical treatment and also as well as surgical treatment. Medical treatment by giving antibiotics and analgesics, and surgical treatment by incision and drainage of the pus. Sometimes adjunctive treatment might be necessary, and this is include sequestrectomy to remove the sequestral, which is more obvious in case of chronic suppurative osteomyelitis, by incision within the soft tissue and removal of the large piece or large sequestral, but the small type might be exfoliated by itself. Also, we may need suturization, in which case, after removal of the sequestral, there is large cavities, and the border of the large cavities it should be suturized. This is to reduce the blood clot formation in case of large cavities. Decortication by creation of perforation in order within bone in order to release the pus within the medullary spaces. Hyperbaric oxygen, actually hyperbaric oxygen, this is also used in case of treatment, in case of resistant type chronic suppurative osteomyelitis, resistance to medical treatment, to antibiotics. So also it can be said that hyperbaric oxygen could be used in case of refractory osteomyelitis, which also means the resistance type of chronic suppurative osteomyelitis to medical treatment, to antibiotics and so on. Hyperbaric oxygen may enhance immunity of the patient by increase, or local immunity by increase the number of leukocytes, and also enhances osteogenesis, bone formation, and angiogenesis, which is blood supply to the area. And also it may act as antibiotics, so antimicrobial action. For this reason, hyperbaric oxygen might be considered as adjunctive treatment in case of chronic refractory or case of resistance type of chronic suppurative osteomyelitis to medical treatment. Also, there is resection and reconstruction. Resection and reconstruction, it is indicated in case of extensive and recurrence type chronic suppurative osteomyelitis. Now, there's another type called chronic focal sclerosing osteomyelitis. Here, as I mentioned before, chronic suppurative osteomyelitis could be suppurative or non-suppurative. Non-suppurative, that means there is no post formation. So it is described as bone sclerosing. That means more bone proliferation. Instead of bone destruction, there is bone formation, bone proliferation. So it could be focal or it could be diffuse. Focal, localized, diffuse, involve the large area. So this is called diffuse. But here we are going to discuss the focal sclerosing osteomyelitis. It is unusual reaction of bone to infection. The infection usually low-grade infection. Any dental infection could be carious lesion, could be pulpitis or pulp infection, could be periodontal or could be pericordial. But it is of low grade. So there is high degree of tissue reaction, I mean bone, and tissue reactivity. So as we can see here, there is radiopacity associated with more bone formation, sclerosing bone. The clinical features commonly affected young adults and children. Mandible is more affected than the maxilla. Symptoms, mild pain, and the pain usually arises from affected pulp, that means from tooth. Bone proliferation rather than bone destruction. Actually, here also there is compromisation of the blood supply. There is decrease in the blood supply. But here, the decrease in the blood supply is due to bone formation, bone sclerosing. So there is decrease in the blood supply. Also, in case of suppurative osteomyelitis, there is decrease in the blood supply. But this is due to pus formation. So since there is pus, in both conditions, there is infection. And this is due to decrease in the blood supply. The management of chronic focal sclerosing osteomyelitis is by endodontic treatment or tooth extraction to remove the causative microorganism or to remove or to eliminate the low-grade infection. The protographical features, it is pathognomonic. Well circumscribed radiopac, as we can see here, this is well circumscribed radiopac associated within the or extending below the apex of one or both roots. Here we can see there is radiopacity, well circumscribed radiopacity associated with the apex of one or two roots. And also there is widening in the periodontal ligament. For this reason, it is described as pathognomonic, widening in the periodontal ligament and radiopacity or well circumscribed radiopacity associated with the apex of the tooth. Here also we can see there is well circumscribed radiopacity associated with the apex of the root, and also there is widening in the periodontal ligament. So this is the condition of chronic focal sclerosing osteomyelitis.